Injuries of the brachial plexus. What are the nerves of the brachial plexus? Means the musculocutaneous nerve, there is the axillary nerve, there is the median nerve, ulnar nerve, and many of the other branches of the brachial plexus like the long thoracic nerve. So one of the nerves, as the injury of the axillary nerve, will lead to the weakness of the lateral rotation and abduction of the arm. Actually, axillary nerve supply the deltoid muscle, and which has the function of the lateral rotation and abduction of the arm. When the axillary nerve is injured, it will lead to the weakness of these movements. Now, the injury of the musculocutaneous nerve, which will lead to the weakness of supination and flexion of the forearm. So, as I've already told in the previous lecture of the brachial plexus, the musculocutaneous nerve actually arises from the lateral cord, and the musculocutaneous nerve actually supply the anterior compartment of the arm, like it is supplying the bicep muscle, it is supplying the brachioradialis muscle, which has the main function of flexion of the forearm. When the musculocutaneous nerve is injured, it will lead to the weakness of the supination and flexion of the forearm. And also one of the cutaneous branches of the musculocutaneous nerve, as the cutaneous branch of the musculocutaneous nerve supply the lateral side of the forearm. So when it is injured, it will lead to the loss of sensation of on the lateral side of the forearm. So this is the diagram of the brachial plexus, means how the brachial plexus has been formed from the roots of C5, C6, C7, C8 and T1 nerve roots. Now the radial nerve palsy. Now injury to the posterior cord, which actually give rise to the radial nerve, is caused by the pressure in the axilla. Like we label it the crutch palsy or Saturday night palsy, as some of the patient that encounters the vehicle incident or any other accidents which will lead to the the fracture of their tibia fracture or any other leg fracture, and that will be resulted into their immobility. So when they have to move, they actually use the crutches, and when the crutches have been used, it actually put the pressure at the axilla. So as we have to support, as the patient have to support themselves, and they put pressure on the axilla, which will lead to the injury to the posterior cord. Another name of this radial nerve palsy is the Saturday night palsy. It actually labels due to as the most of the Europeans enjoy at their weekends. So at the Saturday night, most of the European drunk and actually slept at the chair where they actually drunk, and they will lie like that. One of the arm is hang like that on the chair, and the upper portion of the chair is actually putting the pressure in the axilla, which will lead to the injury to the posterior cord, and it resulted in the paralysis of the arm, and it results in the loss of the function of the extensors of the arm, forearm and hand. Actually, as the radial nerve supply the posterior compartment of the arm, forearm and the hand, and the radial nerve palsy which leads to the wrist drop as the extensor function is lost. So this is the radial nerve, and the wrist drop has been happened due to the loss of the function of the extensor muscle. At the left side, you are seeing how the crutches put the pressure. This is the typical picture of the Saturday night palsy, when one of the arm of the patient is hanging, and while the upper part of the chair is putting the pressure in the axilla. Medial nerve palsy, it actually leads to the loss of the opposition of the thumb and flexion of the lateral two interphalangeal joints. It also produces a characteristic flattening of the thenar eminence, often referred to as the ape hand, as the median nerve actually supply the thenar eminence of the hand. Like this is the thenar eminence of the hand, and this is the hypothenar eminence. So when the median nerve actually get injured, it will lead to the flattening of the thenar eminence, which will be resulting into like the ape's hand. Median nerve palsy, it actually due to the wasting of the thenar eminence of the hand, and the patient has been unable to oppose or flex the thumb due to the paralysis of the thenar eminence. So this is the cutaneous distribution of the median nerve. Means the median nerve is supplying the first three fingers and the lateral half of the fourth finger, and the ulnar nerve will supply the ventral, means the anterior and posterior surface of the last fourth medial part of the fourth finger and the fifth finger, while the radial nerve supply the posterior or dorsal surfaces of the first three fingers, as it had been shown in this picture.